Hello, my name is Lindsay Larsen. I'm a master's student at The Ohio State University, advised by Dr. Benjamin Enger. And today I'm going to be speaking about our trial that investigated postpartum intramammary infections in heifers after internal teat sealant administration at different stages of gestation. So to start, we'll get into a brief background on mastitis and intramammary infections, and then we'll get into more trial information. So we all pretty much know what mastitis is, but broadly it's defined as inflammation of the mammary glands. While this can be caused by any chemical or physical trauma, it is most likely caused by an intramammary infection due to a bacterial pathogen invading the gland. While we know that mastitis and intramammary infections happen in lactating cows, and as an industry, we have a pretty good grip on those infections. Intramammary infections also happen in heifers. So heifers, when we're speaking about heifers today, we're talking about true heifers that have not had a calf yet, have not begun their lactation career. So while producers might overlook these animals as far as infection prevalence, that prevalence is going to range between 29 and 75% of quarters being infected. We also know that the prevalence is going to increase as gestation progresses and we get closer to calving. So that's demonstrated here in this figure. On the y-axis, we have percentage of quarters infected. On the x, we have day of gestation. This is from a few different trials. You can see as we move through gestation, get out here closer to calving, the general trend is upward in IMI prevalence. So as we continue through that gestation, the risk of getting an intramammary infection grows greater and greater for these heifers. We also know during first gestation, there's a massive amount of growth and development within the mammary glands. So here we have a figure of an animal around breeding age. This lightly colored tissue is going to be stroma or supportive tissue, and then the darker tissue is going to be epithelial tissue, which will eventually give rise to the milk producing tissues. So here we can see most of that tissue within the gland is stroma, and 9 months later, that epithelial tissue has kind of invaded the stroma and rearranged itself so that it is the majority of the gland. The most amount of growth and development is also going to occur in that last gestation, or that last trimester of gestation, excuse me, when IMI risk is also at its greatest. So of course, there's going to be negative consequences to these glands having infections. We know in non-lactating glands, an infection will reduce epithelial tissue area and increase stroma. So it's going to increase that supportive tissue, decrease that tissue that will eventually give rise to productive tissue. It's going to induce apoptosis of that epithelial tissue. It's going to increase collagen deposition, damage and scarring within the gland. And overall, we'll have reductions in those secretory cells that will produce milk once the animal begins lactating. Additionally, heifers can carry their infection into lactation with them, so that might manifest itself as a clinical disease in which we definitely have decreased dry matter intakes, or it could be subclinical mastitis, where we're still going to have that elevated somatic cell count, lessened production. These are likely to also persist throughout lactation, and all of these factors are going to combine and increase the call risk of that animal. And we know during first lactation, it's so important to the producer because these animals have only been a financial expense up to this time, and we're trying to recoup some of those expenses and have these animals producing at their best. So switching gears a little bit, we can begin to talk about internal teat sealants. We know as an industry, internal teat sealants are pretty widely used in dry cows. They Once they are infused into the teat cistern, you can see in this picture, it forms a physical block so that pathogens are unable to enter the gland and infect the gland. So it's definitely used as a preventative rather than a treatment or a cure. There is some previous research in primogravid heifers using teat sealants. Typically, these have been infused around 30 or 40 days prepartum, and a lot of this research has been done on more pasture-based systems rather than a conventional, more intensive system. So we hypothesized that administering teat sealant prepartum would reduce the prevalence of intramammary infections postpartum. And that earlier administration, so prior to that 30, 40 days, would differentially reduce the prevalence of IMI postpartum. So we were able to use a large heifer raising facility, also equipped with automatic milking system. They utilized a bedded pack using recycled heat-treated bedding and new sawdust, rebedding once or twice a week. They also had a feed alley with lockups. And as far as fly control, they used Clarifly in the diet and monthly spraying during the summer months. So we utilized 270 heifers total, and each heifer was basically randomly assigned one of these 4 designs. So each heifer had a quarter that was sampled and infused teat sealant around 75 days prior to her expected calving day. Then 40 days later, each heifer had a quarter that was sampled and infused teat sealant around 35 days prepartum. And then each animal had 2 control quarters in which were not interfered with prior to calving. So after calving, we collected colostrum samples from every quarter separately, including the control quarters. Here we have some pictures demonstrating that process. So we were obviously very clean in our sampling and infusing of teat sealant. We used an iodine-based teat dip, then used ethanol squares to clean the teat end, took our prepartum samples, cleaned the teat ends again, and then we found it easiest in these small teats to kind of turn the teat and dilate the teat opening so that you could see it, and then carefully place the cannula and then turn the teat back to its regular position to slowly infuse the teat sealant. For our postpartum samples, we used those to identify intramammary infection status, as well as look at somatic cell count. So in our prevalence of intramammary infections postpartum, in all of our treated quarters, so teat sealant 75 and teat sealant 35 quarters, the prevalence of infection was around 10% at calving. In our control quarters, however, the prevalence of infection was around 30%. So we used Proc-Glimix and SAS with treatment and IMI status as fixed effects and heifer as a random effect to yield odds ratios. So for major pathogens, this is going to include Staph aureus, any strep species, or coliforms. Control quarters were 3.5 times more likely to be infected with these major pathogens at calving than our teat sealant 75 quarters. Control quarters were also 3.4 times more likely to be infected than the teat sealant 35 quarters. For minor pathogens, coagulase negative staph species, control quarters were 5.2 times more likely to be infected than our teat sealant 75 quarters, and control quarters were 4.9 times more likely to be infected than our teat sealant 35 quarters. There was no significant difference between our teat sealant 75 and teat sealant 35 quarters, however. Looking at our somatic cell counts, we use Proc mixed for this with, again, treatment and IMI status as fixed effects, as well as their interaction, and heifer as a random effect. Our uninfected quarters had a significantly lower mean somatic cell count. This is not surprising. Somatic cell count was around 2 million cells per milliliter. Infected with a major pathogen, much greater somatic cell count, around 4 million, and infected with a minor pathogen is around 3 million. So when looking at the interaction, we did see that our uninfected teat sealant 35 quarters had a significantly greater somatic cell count compared to our uninfected control quarters, however. So we found this a little bit interesting. Then when we looked at our uninfected teat sealant 75 quarters, while it wasn't significantly different between the uninfected teat sealant 35 quarters or the uninfected control quarters, it was right in the middle there numerically. So we were able to conclude a couple things with this data. First off, we definitely know that internal teat sealants were effective in reducing intramammary infections in these heifers at calving. This is going to set the heifer up for success as she enters lactation. And we also noticed that somatic cell count increase in those treated quarters indicates that there may be an immune response at the time of teat sealant administration. And those teat sealant 75 quarters would have kind of lessened that immune response by the time of calving compared to those teat sealant 35 quarters. So thank you so much for watching this presentation, and I'll be happy to take any questions.